Let me ask you something. When did you last really look at your fingernails? Not just glance, but actually look. Because here's something most people never realize. Your nails can act like a little window into your overall health. Doctors have long known that certain changes in the color, shape, or texture of your nails can occasionally be an early clue, a quiet signal that something in your body deserves a closer look. Now, before anyone panics, let me be very clear up front. The vast majority of nail changes are completely harmless, but a few specific ones are worth never ignoring. So today I'm asking 3 questions. 1. Why do your nails reflect your health at all? 2. Which specific nail signs are the ones doctors say you shouldn't ignore? And 3. What should you actually do if you notice them? Now, please hear this clearly. This video is for awareness only, not a diagnosis. I can't tell you what any nail change means for you. Only a doctor can. But I can help you know when it's worth getting checked. Let's investigate. So first, why do nails reveal anything at all? The answer is rather elegant. Your nails are made of a tough protein, and they grow slowly and steadily over weeks and months. As they grow, they essentially keep a quiet record of what your body has been going through. The nail also has a rich supply of tiny blood vessels underneath it, which is why a healthy nail bed often looks pinkish. You're literally seeing the blood flow through. So when something affects your circulation, your oxygen levels, your nutrition, or your overall health, your nails can sometimes show the effects in their color, their shape, or the way they grow. Because they grow so slowly, nails can even reflect something that happened weeks ago, like a serious illness. Now, it's important to keep perspective. Nails are also affected by everyday things like injury, harsh chemicals, water, aging, and simple wear and tear. So not every mark means something medical, but a handful of specific changes are worth knowing about. Let's go through them, starting with the single most important one. Let's start with the most important sign of all, the one that genuinely should never be ignored. It's a new, dark vertical streak or band running down a nail, like a brown or black line from the base to the tip. Now, here's the balanced truth, and please hold both halves. In many people, especially those with naturally darker skin tones, dark streaks in the nails can be completely normal and harmless, and several nails may have them. So this is not a reason to panic. But, and this is why it matters so much, in some cases, a dark streak under a nail can be an early sign of a serious type of skin cancer called melanoma. The features that make doctors want to take a closer look include a streak that is new or recently changed, one that is getting wider or darker, a single streak that looks different from your others, or dark color that spreads onto the skin around the nail. Because catching melanoma early makes such a difference, any new, changing, or unusual dark streak is absolutely something to have a doctor check, ideally a dermatologist. Better to check and be reassured than to ignore it. The second sign is one doctors have watched for over 100 years. It's called clubbing. Over time, the fingertips gradually become wider and rounder, almost bulbous, and the nails curve downward over them, losing their normal angle, a bit like the back of a spoon turned over. It usually develops slowly, so it can be easy to miss. Why does this matter? Because clubbing can sometimes be associated with certain long-term conditions affecting the heart or the lungs, often linked to lower oxygen levels in the body over time. It doesn't always mean something serious, and some people simply have nails that naturally curve. But true clubbing that develops over time is something doctors take seriously because of what it can occasionally point to. So if you notice your fingertips becoming rounder and your nails curving more than they used to, especially alongside any breathlessness or other symptoms, that's a pattern worth mentioning to your doctor. It's not about fear. It's about giving your doctor a useful clue that in some cases has helped catch important conditions earlier. The third thing to know about involves the shape and color of the nail. Sometimes, instead of being slightly curved outward, a nail becomes scooped or spoon-shaped, dipping inward in the middle, almost as if it could hold a tiny drop of water. This particular shape can sometimes be associated with low iron levels in the body, the kind seen in iron deficiency. Alongside this, look at the color of your nail beds. Healthy nail beds usually have a pinkish tone from the blood flowing underneath. If they look unusually pale or whitish, that can also sometimes be linked to low iron or other issues that a doctor can easily check with a simple blood test. Now, plenty of things cause pale or oddly shaped nails, and on its own, it's rarely an emergency. But if you notice spoon-shaped or persistently pale nails, especially if you also feel unusually tired, weak, or short of breath, those can be signs worth mentioning to your doctor. Low iron is common, very treatable, and easy to test for, so it's exactly the kind of thing worth catching. The fourth sign is one many people, especially as they get older, will recognize. Nails that become thickened, yellowish, brittle, or start to crumble at the edges. The most common cause of this is a fungal nail infection, the same family as athlete's foot, which is very common, particularly in toenails and in older adults. It's usually not dangerous, but it can be stubborn, may spread, and often doesn't clear up on its own or with ordinary creams, frequently needing proper treatment from a doctor. Now here's the nuance. Thick or discolored nails can occasionally be caused by other things too, including certain skin conditions like psoriasis. And in people with conditions like diabetes or poor circulation, foot and nail problems need extra care and shouldn't be ignored, because healing can be slower and complications more likely. So if your nails are becoming thick, yellow, or crumbly, it's worth having a doctor confirm what's actually going on and advise the right approach, especially if you have diabetes or circulation issues. Guessing and using the wrong remedy for months often just wastes time. The fifth sign is about the texture and surface of the nail. Two patterns are worth knowing. First, deep horizontal lines or grooves running across the nail, sometimes called Bowes lines. These can appear after the body has been through a significant stress, like a serious illness, a high fever, or another major event, because growth at the nail base paused briefly, leaving a groove that slowly grows out. So a horizontal ridge can be a quiet record of something the body went through weeks earlier. Second, lots of tiny pits or dents in the nail surface, like the surface had been pricked with a pin. This pitting can sometimes be associated with skin conditions such as psoriasis. Now, to keep perspective, gentle vertical ridges running from base to tip are extremely common and usually just a normal part of aging. Those are generally nothing to worry about. It's the deep horizontal lines or noticeable pitting that are more worth mentioning to a doctor, especially if they appear across several nails or alongside other symptoms. As always, the nail is just a clue, not a conclusion. The sixth sign is one to be more alert about, because it can sometimes point to something needing prompt attention. If your nails or the skin beneath them take on a blue or purple tinge, it can be a sign that the blood isn't carrying enough oxygen or that circulation to the area is reduced. Now, there's an everyday version of this. Fingertips and nails can temporarily turn bluish or pale simply from being cold, and they return to normal once you warm up. That's usually harmless. But blue or purple nails that appear without an obvious cause, that don't go away, or that come along with symptoms like shortness of breath, chest discomfort, or feeling unwell can be a signal of a problem with your lungs, heart, or circulation, and that deserves prompt medical attention. So this is one where context matters a lot. Cold hands turning blue and recovering is one thing. Persistent or unexplained blue nails, especially with breathing or chest symptoms, is a reason to seek help quickly. When in doubt, it's always safer to get checked. Now let's quickly clear up one of the most common nail myths, because it causes needless worry. You've probably heard that little white spots or marks on your nails mean you have a calcium deficiency or that you're lacking some vitamin. For most people, that simply isn't true. Those tiny white spots are usually completely harmless, and most often, they're just the result of minor bumps or small injuries to the nail as it was forming. Little knocks you probably don't even remember. They grow out on their own over time and almost never signal a nutrition problem. So if you've been quietly worrying about white spots or rushing to buy supplements because of them, you can usually relax. It's a great reminder that not every nail mark is meaningful. In fact, most are not. The skill isn't to panic at every little thing on your nails. It's to know the difference between the harmless, everyday stuff, like white spots and gentle ridges, and the small number of genuinely important signs we've talked about. So let's bring it all together with what to actually do. So here's the practical, safe guidance. First, the reassuring part. Most nail changes are harmless. Everyday ridges, white spots, and minor marks rarely mean anything serious, so there's no need to inspect your nails in fear. Second, here's when it is worth seeing a doctor, ideally checking in without delay for a new, changing, or unusual dark streak under a nail. Nails or skin turning blue or purple, especially with any breathing or chest symptoms. Fingertips and nails that are gradually clubbing, or any nail change that comes alongside feeling unwell, very tired, or short of breath. Also worth a check, spoon-shaped or persistently pale nails, thick or discolored nails that won't clear, deep horizontal lines or noticeable pitting, especially if you have diabetes or circulation problems. Third and most important, don't try to diagnose yourself from a video. A doctor can look properly, sometimes with a simple test, and tell you what's really going on. Bring it up at your next appointment or sooner for the urgent signs. Checking early when something seems off is simply the safest, smartest thing you can do for your health. So let's step back. What your nails really teach you is a beautiful, balanced way to think about your whole body. On one hand, your body is constantly giving you small signals in your nails, your skin, your energy, and it's worth paying gentle attention because occasionally those signals matter. On the other hand, most of those signals are harmless, and living in fear of every little mark helps no one. The wisdom is in the balance. Stay aware, but don't panic. Notice changes, but let a doctor, not the internet, decide what they mean. So tonight, take a calm, curious look at your nails. If they look healthy, wonderful. If you spot something new, dark, blue, clubbing, or simply not right, don't panic, and don't ignore it either. Just get it checked. Remember, this video is awareness, not diagnosis. Most of the time, the news will be reassuring, but catching the rare, important sign early is exactly how this kind of awareness saves health and sometimes lives. If you found this helpful, share it with someone you care about. It might be the nudge that gets them to check. Take care of yourself, and I'll see you in the next one.